This presentation explains the normal radiographic anatomy of the cervical spine using standard X-ray views like AP view, lateral view, and specialized odontoid view. So emphasize that understanding normal anatomy is essential before identifying the trauma or pathology. So let's begin with the learning objectives. So learning objective of this video is identify normal cervical spine anatomy on X-ray, understand standard views, recognize key alignments or key lines of cervical spine. So standard cervical spine X-ray views are the AP view and lateral view. So these are the most commonly done views, and the open mouth view or odontoid view is specialized view for the dense or odontoid process of the C2 vertebra. So in this image we can see that this first image is the AP view, whereas the lateral view is the second, and this is the open mouth or odontoid view specialized for the visualization of dense. Now the lateral view. Lateral view is the most important view in the imaging of cervical spine. So first see for the exposure that from C1 to C7. Ideally it should include the C7 and T1 junction as we can see in this image. And before going to the pathology or alignment, see or ensure the adequate visualization of the cervical spine. Now after these points, see for the alignment. So how to see the alignment? It is covered by the four lines, that is the anterior vertebral line, posterior vertebral line, spinolaminar line, and the spinous process line. So these are the four lines. So these should be in same alignment and equidistance. So this denotes that the normal alignment or cervical lordosis. So there is slight curve of cervical spine. This is called the cervical lordosis, and this is normal. After seeing the alignment, see for the vertebral body. So vertebral body should be rectangular in shape in lateral view. So this is the rectangular in shape. Its anterior and posterior margin should be regular, and its size gradually increases as it goes downwards. After seeing vertebral body height and its shape, see for the intervertebral disc height. It should be equal in height at all levels. If it is narrowed or widened, then think of the degenerative change of pathology. If it's narrowing, intervertebral disc narrowing, then this is due to the degenerative change, and if it is widened, then think of the ligamentous injury. And in vertebral body, C7 is prominent, so spinous process of C7 is larger than the all other cervical vertebral body, so it is used as the landmark. As we can see here, C7 is largest, so its size is long and it's prominent. What we see in this image, can we differentiate, or is there any pathology in second image? So there is a fracture in C4 vertebra. As we can see, its interior height is reduced as compared to the other. We can compare from here. So its interior height is reduced and there is discontinuity in the cortex. So this is the fracture of C4 vertebra. Now the prevertebral soft tissue. So how to know that this is the normal prevertebral soft tissue? So it is measured at C2 level. It should be less than 6 mm, and at C6 level it is less than 22 mm in adults. If its size is increased, then think of the prevertebral abscess or any pathology, other pathology, mass or any other causes. Now the AP view. What we see in AP view, that is the vertebral body should be in midline, and on either side there is transverse processes or lateral masses, and in center the spinous processes. So spinous, this should be aligned in same line. Here we can see these are the vertebral bodies. These are the lateral masses and these are the spinous processes. And the upper edge of the vertebral body are called the uncinate process in cervical vertebra. And lower are these are the ribs, first, second rib. Now the open mouth or odontoid view. So this is the specialized view where we can see that this is the dens. These are the lateral masses of the C1 and this is the atlantoaxial joint. So symmetry must be assessed in this view. So we can compare these two images. Can we see any pathology in this image? If you see, please comment in comment section. So I am explaining this image. This is the area where there is a dense fracture is noted. Now the take home message for the cervical spine X-ray. So check for the alignment. So in this image we can see that there is loss of the cervical lordosis. Identify normal anatomy. So see for the first alignment, that is the anterior posterior vertebral line, spinolaminar line and the posterior spinous process line. So these are the lines. So identify first the normal anatomy. Then see for the symmetry, that is the height of the vertebral body and intervertebral discs also, and these lines should be symmetrically placed. And assess for the prevertebral and paravertebral soft tissues. So these are my references and some images taken from the different sites of the Google. Thank you for watching, and if this video is useful for you, then like, share and subscribe. Thank you.